Knows me. Thank you all for being here. Katie, do you want to just quickly review the agenda? And we can kind of talk about what we're going to talk about, do introductions, and then get to the meat of today.
Yeah, sure. Do you just want me to share the agenda I sent you and we'll walk through it that way?
Yeah.
Cool. Okay, so like Joey said, first we'll go ahead and do welcome introductions for those who are new and maybe don't know each other. And then we actually do have an implementation application to review today. So that process will kind of look like Lauren will present, and so she'll go through the overview of the purpose of the application, what it's for, the strategies that it aligns with within the KCPA plan, and then the other sectors involved, next steps, and amount being requested for funding. And then after that, if we have any questions or concerns or perhaps feedback, we'll share it then. We'll decide as a group whether or not to pass it through to go to the final stage, which will be, it'll go to the core work group, and then the core work group members will give final approval. And then after that, we can continue our discussion about other implementation application ideas, and then just general group updates, and then some other general announcements. So that's it. That's what we have for today.
Super. Katie, do you want to start us off with the intros?
Yeah, sure. So I'm Katie Amy, and I'm with the Kansas City Healthy Lifestyles Collaborative. I help to support various number of our initiatives, one being the KCPA plan. And so we have 10 sectors, and I help support 5 of them, one being the public health sector. And I will go ahead and pass it over to Kelly, actually.
Hey everyone, my name is Kelly Clay. I am also with the Kansas City Healthy Lifestyles Collaborative. I am brand new. I used to work over at the Kansas City Health Department in violence prevention. And so now I have moved over in a similar position as Katie, unsure which sectors I will be taking on, but there you go.
And Kelly, who do you want to pop it over to?
Sandra.
Hi, I'm Sandy Reese. I'm a dietitian with the Johnson County WIC office. And I guess I've been working with the public health sector for a while, for months. Let's see. I will pass it on to DC.
Hey everyone, I'm DC Okanta. I'm part of the Johnson County Health Department in the epidemiology division. Been working with this group for a few months now. I think that's it. Let's do Leah.
Hi, I'm Leah Oladeton. I work at Clay County Public Health Center with Lauren. And I'm over the community health program, and I have been a part of this group for about 6 months. And then I'm not sure who has not gone yet. I will say Lauren, maybe?
Haven't gone. Hi, I'm Lauren Cromie. I'm also with the Clay County Public Health Department. I'm a community engagement specialist. And yeah, I started with this group about the same time Leah did 6 months ago.
And I think last but not least is Simone.
Yes.
Can you all hear me? Is it very loud in the background? Okay, perfect. My name is Simone Taylor. I am the Regional Women's Health Analyst in the Office of the Assistant Secretary for Health. And I've been a part of this sector, I guess, pretty much since it started. I think that's the whole thing. So glad to be here.
And Simone and I used to work together at KCMO Public Health. And so we're like a little public health family here. Okay, Katie, do we want to throw it over to Leah and Lauren to talk about their project?
Yeah, I'd be more than happy to do that after you introduce yourself.
I think everybody knows me, Joey Leitner. Yeah, I'm an assistant professor over at UMKC School of Nursing Health Studies. And I've been in public health forever and done, work on public health stuff in general. That's the most general bio on the planet, but whatever.
Awesome, thanks. Okay, so Leah, Lauren, who is presenting? Lauren, you're on mute.
Of course. I will be the one presenting about it. So
Okay. Do you want me to pull up your application or would you like to? So you can control how you go through it.
you can pull it up if it's
Okay.
easier for you. That way we can just kind of go through it point by point.
Yeah, let's do it.
Awesome.
Okay, can everyone see my screen? Great.
Yep.
Whenever you're ready.
Okay. So essentially what we would like to do is we want to contract the services of Bike Walk KC to provide Confident City Cycling up here in the Northland. We've already talked to them about this. Confident City Cycling is pretty much what it sounds like. So they teach, not only the basics of bike riding, but also how to safely ride in the city as far as things like traffic laws, making sure you're aware of your surroundings, and just general bike maintenance. So it's really about using bikes as both recreation and transportation. And then that serves as the prerequisite for getting LCI instructors trained in the Northland. So essentially what we would really like to do is use our more local bike shops to actually train the instructors. Bike Walk KC is an amazing organization. I know they do a lot with this group as well. They've been doing a lot with us. It's not super feasible for them as it stands now with staffing and budget to come very far up north. So a lot of these kind of further out of the city communities, I won't go as far as to say rural, but a lot of the smaller communities that could really benefit from this kind of instruction are just not able to get it. So we want to target Smithville, Kearney, and Excelsior. Especially Excelsior tends to they've got a lot of trails and things like that, but they really struggle with transportation, as does a lot of Clay County. So this would kind of be an additional avenue for transportation that also promotes physical activity. And we want to shift the social norms toward viewing cycling as a tool, making it just kind of normal to bike to the store or bike to really wherever you need to go in town. So that's kind of the overview. It would support a few of the strategies of this group. So it would support strategy 9, transportation and public health agencies working to implement initiatives to encourage, reward, and require more walking, cycling, and transit for routine transportation. Using tactics 1 and 3 if you've got your plan near you. So it gives these communities the tools to regularly host their own short-term physical activity events. And by doing that, we hope to increase overall engagement with existing infrastructure for biking and walking, and maybe eventually create a public shift in infrastructure demand. If more people are biking, more people are walking, then hopefully we would see that reflected in future city plans. It would also support strategy 35, using tactics 1, 3, 4, and 5. So disseminating tools and resources important to promoting physical activity. We want to leverage the existing community assets and tools to promote physical activity. I am pretty embedded in a few of these towns for the Drug-Free Communities Grant Coalitions, which are already pretty multi-sector. So there's businesses, schools, community centers, churches, and they all do a really good job of coming together for their town. So we would really like to use those relationships and these strong social ties to promote what we're doing. Strategy 38 is also supported. So creating, maintaining, and leveraging those cross-sectoral partnerships. I kind of explained that we already have a lot of cross-sectoral relationships in those communities. We're also kind of hoping that by promoting this plan via small businesses, we're taking that multifaceted approach and being supportive of the community itself. I think a lot of people don't want to be told what to do. And there are a lot of these smaller communities that maybe aren't even a super huge fan of Bike Walk. But they would absolutely support their own businesses and community members. And then by promoting, again, that physical activity, getting the business owners involved, we would get more supportive infrastructure for that in the future. And then 39, public health agencies investing in equitably in physical activity. Basically, this would give us an avenue to invest in physical activity more by financially and logistically supporting these trainings, and providing the education resources for the physical activity. So it would give physical activity a more equitable share of our resources compared to what we already provide for things like youth substance abuse prevention and food insecurity and environmental health in these communities. And then it would engage local businesses as a new sector. So we have not spoken to some of the places we don't have an existing relationship with. But I will say that when I brought this up with the owner of Smithville Bike Co-op, he was very enthusiastic. And he said that himself and 2 other people would already be interested in participating in this Train the Trainer program. So we can go on to system levels. It addresses a few different system levels. So individual and interpersonal behavior. We want to increase people's knowledge. We want to change their habits. We want to change attitudes about biking and walking as just an everyday form of transportation. And some of this will be individual behavior, and some of this we'll hope is community level behavior. And then we also want to, give information, develop these instructors. Once they get their certification, we will absolutely help them to find places to teach and reach out and help them make those connections so that they can do this as much as they want. We also kind of expect that indirectly, this will impact things like policy and advocacy priorities. So like we said, we're hoping that if biking and walking becomes more of a demand, that it will be reflected in policy, it will be reflected in infrastructure, and then just kind of be promoted as an alternative to driving everywhere. So while we're only seeking funding from the public health sector, the infrastructure and the business sectors would also be involved. So with Bike Walk KC, we want to use the training courses to create a promotive platform for bike-friendly policy and infrastructure. We are also doing some other things with Bike Walk KC right now that are in the works that are building kind of that policy promotion relationship. So we'd like to tie those together. They are aware of both sides of what we're hoping to do. And then it's also notable that Smithville recently received a large grant from MARC to improve sidewalk infrastructure. So we'd really like to try and leverage those changes that the investment will bring when that's completed. We'd like bike-related businesses to act as recruiters and hosts for these trainings. That doesn't necessarily have to be a bike shop. I'm really hoping to approach Other Trails Coffee Shop in Excelsior Springs. If you're familiar, they have a lot of bike trails around there. So there's kind of a little trail-themed coffee shop, and they sell like some biking accessories and things like that. And we hope that other businesses in the community will recognize that public good and help us promote the program as well. We would also expect that parks, early childhood, and school sectors would be somewhat affected due to more community biking activity and increased opportunities for parents and children to engage in physical activity. So after the completion of the project, by training locals to provide this education, these services could continue for years into the future. As funding is available through CCPHC, we would continue to partner with businesses and instructors to provide resources for these classes. We have a maternal child health grant that tends to be recurring. We reached out to them. They said they couldn't necessarily buy bikes, but they could absolutely do like bike helmets. So we can provide support. And again, we can provide that logistic support for really as long as they need it. So making those community connections. I basically go out and make friends for a living. So I'm happy to make other people be friends with each other and promote these programs. So for the money being requested, ideally we would request $6,250. So the funding would allow us to rent out space for the Confident City cycling class and pay Bike Walk KC to facilitate that. The plan is to do that in Kearney which is pretty centrally located of the 3 communities. And then it would also allow us to reimburse the cost of 8 LCI instructor training courses for participants from those areas. The reason we chose 8 is because that is the minimum to hold the training. And then we would host them at local bike shops. This would include their mileage cost to attend the trainings. And then we would like to incentivize participation and buy-in from the local bike communities by providing those training participants with a $100 gift card to the local bike shops. So basically, if your bike shop is the one promoting it or your bike related business, and they tell us, hey, this is who sent me, I would like a gift card to this place, it gives them both kind of an incentive to do the training and to promote the training. And so there's our budget breakdown there at the end. And that is pretty much our proposal. Does anyone have any questions?
Yeah, feedback for Lauren from the group?
I hope being quiet is a good thing.
I'm happy to start. Lauren, I think that this is great. We've worked with Bike Walk on several different projects, and they, we haven't evaluated one of this course specifically, but I think this does a couple different things, that all the stuff that you mentioned, as well as cyclists have a tendency to be like the squeaky wheel,
Mhm.
and they will show up to city council meetings to, when plans get developed, they'll show up and participate oftentimes.
Mhm.
And I think that's great, because while it can be annoying at times, because I'm often one of them, it pushes people to listen. And I think that's a really good. So the more we build capacity in active transportation, whether that's for, recreation or transportation purposes, that's all great. And so I don't see an issue with any of this. And I think that if this builds the cycling infrastructure and the walking infrastructure up in the north, then yeah.
Yeah, that's what we would really love to do. And we were very excited when I mentioned it to the Smithville bike shop owner, who is on one of the coalitions that I'm on. He also happens to be the mayor. So he has, while that's not guaranteed to be sustained, he does have some political sway anyway, which would kind of hopefully amp up this project. He was very enthusiastic about it.
That's great. Yeah. I mean, if you can already build on what's happening already, then that's even better. Right? So I would add, if it were me, I would add at the organizational level, right? You're kind of building at that level, and then also at the policy level, not just kind of built environment stuff, but
Okay.
Yeah. So I would be in support, is what I'm trying to say.
Awesome.
I mean, I don't have anything to add. I think you did a really good job of explaining our goals and our desires and our plans, Lauren. So thank you for presenting that so well.
Thanks for helping.
So if there is no additional feedback or questions, we can do this one of 2 ways. I do have a Mentimeter, which is what we use to score in the core work group when we're finalizing an implementation application, or we can just give a verbal approval. Joey, how do you want to handle it?
I'm good with whatever. Does the Mentimeter have the breakdown? Because I know we, in the core work group, we vote in the 3 different categories.
Yeah, it's got all the questions. I didn't have time to do screenshots or photos of the sections to include, so I hope everyone has a decent memory.
So why we bring it
Okay.
up is just so that Lauren will see kind of what the core group looks at, in case she gets any questions or anything from them.
Yeah, so actually during the core work group, you or I will present on her behalf.
Yeah, of course. But if something goes back.
Yeah,
Yeah.
true. Okay, let me share my screen. And then I also posted a link in the chat, if that's easier, but I'll give everyone just a couple minutes to go ahead and scan the QR code or use the link I posted in the chat box. Everyone could hit that thumbs up. That would be super helpful.
I think I just passed it, Katie. Sorry.
That's okay.
I'm like clicking through to like where I can vote, you know?
Okay. I'll go ahead and proceed to the first slide. There's nothing on there. Okay, well, that's fine. So the first question, does this application align with KCPA plan, strategies and tactics? Looks like overall consensus is yes. Great. Is it multi-level? Looks like everyone agrees on that one as well. Is it cross-sectoral?
Lauren, I will say that I think oftentimes people are like, oh, have you reached out yet to the infrastructure group? And so if you haven't, you might want to consider doing that beforehand. But also, this is heavily infrastructure, and you're working with Bike Walk, who's also co-leading that group. So, like, I would
Yeah.
just, cross those bases in case anybody asks that question. I think that question gets
Mhm.
asked quite a bit. But
So that actually, I had planned on reaching out to them, and then the infrastructure meeting was canceled this last week.
yeah.
So, but I was
Yeah.
also going to ask, like, is there a specific way to reach out for them? Because I mean, would they be kind of splitting the funding with public health, or how does that work?
So, Joey, do you mind if I answer? Okay, so you have the option, you can ask to split the funding between public health and infrastructure if you're wanting to take it to the infrastructure sector. If you're just solely focused on this group, I know you had a statement in your application. I can't remember if we talked about that or you just had it that you're only requesting
Mhm.
funding through public health. Then you don't need to. You just need to mention that
Okay.
the other sector groups are involved, and you can still reach out just so that they're aware of this application to see if that
Okay.
anybody there would be available to help or provide feedback if you want it. So,
Yeah. Yeah, I think initially I was just reaching out to public health because this is the one we're most involved with.
yeah, and
And
a
I
lot of
haven't.
your strategies were public health too, I noticed. So,
And there's
and
no reason to like, because if they don't meet again for a month, Lauren, there's no reason to like hold back. Because when we
Okay.
when the group meets, we can just like, move it forward.
Right.
Yeah.
Okay.
yeah. And that was kind of the goal too. So we actually have a core work group meeting coming up. I believe it's not next week, it's the week after. So if we did have to wait for the infrastructure, then it would be another entire, like Joey said, a month. But if you do
Yeah.
want to talk to them, let me know. I'll connect you with our co-leads.
Yeah, I mean, I would love to chat with them. We are, just because of how the timeline is working out, hoping to just kind of move forward quickly because we have to get all of this scheduled and promoted. And we want to ideally do that before it's winter again.
Okay. I'm making
Yeah.
myself a note.
Lauren, if there's any questions on that stuff, I'll like advocate on your behalf because it's summertime and May is bike month, right? And
I
like
know.
done so that we can, impact change.
Mhm.
Oftentimes the barriers get in the way, right? So
Absolutely. Well, and one other thing to mention is, like, when I talked to the Smithville Bike Co-op owner, he invited me to come out. He's like, yeah, bring some resources and then you can just gauge some interest. So this weekend, I'm actually going out to the gravel grinder in Smithville to set up a booth and just talk to people and be like, hey, this is not guaranteed at all yet, but if we get them funding, is this something you would be interested in doing in the future? And hopefully collect some names and email addresses so we can hit the ground running if and when we're able to fund it.
Awesome. So we'll go ahead and finish scoring this. This is the last question. Clear next steps. So it looks like overall, yes. So it passed through the sector, and with how this looked like, I'm sure it's probably going to be great for the core work group as well. But yeah, so I'll keep you posted, Lauren. Like I said, our core work group meeting is in the next week or so. And after we have it, I'll let you know the overall, if there's any feedback or questions, if it needs to go through another review process, or if it passes through.
super, yeah.
Oh, I was
What's
muted. Sorry. I said thank you.
Oh yeah, no worries.
Thanks so much.
Thank
any
you.
other Any other discussions on that stuff, guys? Okay, Katie, what's next on the agenda?
Um. I think we're just going back to our previous discussion about implementation application ideas or just implementation group projects we could work on. Doesn't have to be an application. So
So I have two things, if that's okay, if I can jump in. So yeah, so Katie mentioned, you know, we have more money. So if anybody wants to do anything, so I'm looking at like Johnson County, if you guys want to like have any funds to do any, I'm thinking like, you know, worksite wellness kind of stuff. Any of that kind of thing. If you want to jump in, and I'm happy to like yield the floor to anybody. Simone, I think that would also work for like HHS. I mean, you guys are part of public health, right? And so if there's anything that you guys wanted to do in the office too, happy to support that stuff, I think. Katie, I'm curious, have you, Robin, and other folks talked about the fall quarterly meeting?
no, so Shelley used to plan those, and with her leaving, we haven't had time to discuss it as a group.
Okay. Will you move that forward before our next meeting?
Yeah, I can do that.
Yeah. So guys, in the past, I don't know if we've all kind of chatted about this, but you know, getting all of the public health folks together at the quarterly meeting to you know, talk about physical activity among like public health in the metro area, right? So really like bringing people together for breakfast, you know, talk about the Kansas City physical activity plan, and then talk about, you know, how we can kind of all work together. Also, you know, mention that we have funds available to do stuff. But like, you know, we have a ton of resources among this group and then all of the other folks that we work with, right? So we should be able to, I think we need to get everybody on the same page, you know, just to like be in the same room for a hot minute. Talk about all the other stuff, and then bring together all of the chip chaw, you know, physical activity kind of things that all of us are working on, and kind of sharing capacity to do things, right? I mean, we've done some stuff in this area, and so I'm hoping that for the quarterly meeting, which I think is in September, if I remember right, we can make that happen. What do you guys think about that? Yeah, I think it's a good idea. And so Simone, we're gonna jump in.
I've got a question. Can you hear me?
Yeah, it's a little messy, but I mean, I could.
Okay. If we have partners that we're working with that are looking to do some physical activity things in the community, could we bring those forward for potential projects? And what is the best way for that?
Yeah. So I think as long as you know, as long as it aligns with the strategies and tactics of public health group, I mean, that's where this would go. Totally. I think the best thing to do is connect people with either Katie or Kelly, and you know, get them to like kind of put their ideas on paper, and then we can talk about it here. And if we all agree that that's a good use of funds and that we should support that, it goes to the core work group and moves forward.
And I say that because, I mean, HHS, although we're in the building, it's very disjointed these days. So I'm also thinking about how we can support community partners from our, you know, from our land that are doing the work already. And that's a lot of what we do.
And Simone, I think that's a great idea because, you know, like we're all here and we're all invested, and like we're, you know, like government workers, right? But the people who are actually delivering programming, those are community folks who aren't here and often don't have the like, you know, who wants to like write an application and put it in paper? You know, that stuff is like, it's an extra barrier that really doesn't need to be. And so if we can use kind of our expertise in doing that kind of paperworky stuff, you know, managing the system, I think that's a good thing for everybody. Cool. Other thoughts and questions, concerns? All right, so Katie, back to you. If you could chat with Robin to talk about, you know, the fall quarterly meeting, and if we could, because I think we're gonna have to get that, if we're gonna do that, we got to get that on people's calendars. I would hope for the fall because I'll be there in the fall. I will not be there in December. It's too cold. I can't do it. Cool. Anything else on implementation stuff, guys? Anything else that we want to talk about today? I don't have anything on that front. I should probably think about it and get some of the people we work with to submit some implementation ideas. I think, Katie, that's the end of our agenda.
It truly is. Well, it's the end of our work portion of the agenda. So, the next thing on the list is group updates. So if you have anything that you're working on or doing you'd like to share, or let's say you're hosting an event, this is the time to let the group know, and it's also good information for me to have to include in our monthly newsletter. So does anybody have anything they'd like to share?
I mean, we worked with Nikki Fit and Makita Burton. Nikki does like stuff on the east side. And so she has some free classes that anybody can go to. So if you go to like, I think it's just nikkifit.com, there's free classes available, both like in person and streaming. And so Nikki does a really great job of like, doing high intensity kind of like, movement based stuff, which is awesome. And it's a ton of fun. And so we are helping, fund some of that stuff to evaluate really like, does community-based fitness stuff work? And like, what are the real outcomes of community-based fitness? So that's one thing. And then, Makita Burton does yoga on the Vine, 18th and Vine, every Saturday morning. And so those sessions are free. And if it's hot, they move them indoors. And so or if it's cold or there's bad weather or something, so they have all of that stuff set up. So if you want to go to any of those, you can just like look up Yoga on the Vine on Instagram, and Makita does a really good job of posting every week what's happening there. Sometimes they have food and like give out yoga mats and other stuff. And again, it's just fun, cool Saturday morning stuff. We are also doing interviews with elected officials to talk about transportation stuff. And so if you have any elected officials that, you have like kind of good connections with that would be willing to chat with us about, for an hour about, appropriations for transportation and what they think about, public transit, feel free to send their names our way. We are kind of looking like metro wide. And so including like Smithville, Excelsior Springs, other areas. So, because we really want to understand kind of what is the elected officials' role in funding public transit. And then we have a whole bunch of other projects going on, but other folks. Simone, is there any money coming down the pipe anytime soon?
Oh, there is not. Things are getting tighter and tighter, but we have our regional director who we have a really close relationship with here in the region. So if ever there are events or things that you all want some HHS support or a regional director to come out and kind of see the work you're doing and kind of lift it up nationally, let me know. Same for me. I'm happy to support any work that's happening in this area.
Simone, this is like off topic, but on similar topics. So our CDC Reach grant, if we could have the regional director when we have our site visit, because we have a site visit this fall sometime, come out and say hi, and then we can kind of do the dog and pony show with our program officers and those folks, as well as the Region 7 folks. That'd be fun.
Yeah, I can get you in touch with his staff assistant, or make an introduction. Just let me know what you want to do. We work really closely with them. So, yep.
When it gets closer, because we don't have a date yet, when it gets closer, I'll reach out. And then Simone, do you work much with the Collaborative to Advance Health Services? They have a whole bunch of like Title 10 stuff and other things going on. I'll have to introduce you because they do some really great work. I mean, not only in Region 7, but nationally, they do like a lot of train the trainer stuff with women's health.
Yeah, that'd be great. Thank you.
Yeah, absolutely. Other folks.
Leah, have we told them about Family Fun Day yet? Okay, so we have, it's in, oh, good.
I haven't put in our newsletter yet because it's ahead of time, but I will probably like in the next month or two. I'll pop it in there. So we've
Yay.
gotten it around for sure.
Awesome. Is it in August or September this year, Leah?
It's on September 14th from
Okay.
2, yeah.
Yeah, so first of all, if you just want to promote it, it's an event that we do in North Kansas City every year. Like, so big family event, library comes out. There's just all kinds of fun things promoting family health. But it might be a really great thing if you guys want to set up like a booth for the more public facing aspects of this group. You'd probably be more than welcome to. I can get you in touch with the organizers.
I'm gonna drop a flyer in the chat, and yeah, reach out to Lauren or I if you are interested in participating with a booth, or if there's anything else you'd like to be a part of it with. It's a really, I think last year we had like over 500 people attend, so it was pretty big community event right there in North Kansas City. So
Yeah, it's primarily run by our WIC office. So there's just a lot of emphasis on healthy kids. So yeah, that's it for us.
And if anybody from the Kansas City Healthy Lifestyles Collaborative needs a table or table covers or giveaways, happy to help folks out.
Well, at the very least, if there's not like a booth, we can also do like giveaways from you guys. If you have promotional items that you want us to distribute, we do that for other organizations too. Like we have Bike Walk KC lights coming. We give out a lot of 988 promotional stuff. So just kind of getting word out about things going on in the community via promotional items. We are always happy to come pick those up and then distribute them at all the million events that we go to. So
Lauren, if you want or need any 988 or any of that kind of stuff from us, I can definitely make sure we get you that stuff. I'm sure you have access,
awesome.
but if you need to, let me know.
Yeah, sounds great.
I'll talk with my team and see if we have anything or the capacity to like set a booth up, and I'll get back to you, because I know that we've got like our Move Together KC campaign that we're trying to push right now.
Yeah, just let me know and we'll make it happen. So
Sounds good. Thanks. If no one has anything else they'd like to share, I can share information about our Kansas Healthy Lifestyles Collaborative Quarterly Meeting coming up, which is June 6th. It is just around the corner. So Heather Leedy, I'm gonna be honest, I don't know much about this topic or this person, but that is our presenter. And the title of the presentation is From Risk to Resilience, Harnessing Protein for Youth Wellness. So this will be like more of a nutrition-based focused presentation. If you have any questions, please let me know via email, and I will do my best to get back to you. I'm still learning a little more about it. We just recently booked the speaker, so but I will drop the registration in the chat if you're interested. I think I did include her bio in the registration form. Hopefully I'll have some more information. That's all I've got, except next meeting date.
When is that, Katie?
Cool. Thursday, June 20th. And I will drop the link to register for the next meeting.
Katie, can we talk about the July meeting?
Yeah, just you and me, or the entire group?
Can the entire group just hang on just for a second? Guys, is it okay if we push the July meeting back a week to July 25th? Because I am going to be in Spain doing a full Ironman that week before, and it's going to be a little hard for me to get to my computer. Everybody's
actually works better for me. So
Leah, were you going to say something?
oh, I was gonna say, I guess if you have to go do that, we can. Yes. Okay.
It's terrible, right? I know. Yeah.
I'm
Does that
good.
work for you? Okay. Katie, does that work for you?
Yeah, July 25th?
Yeah.
Perfect.
Cool. All right, guys. Well, happy Thursday, Tuesday, Wednesday. I have no idea,
It's
honestly.
Thursday.
Yeah, there you go. Enjoy the sunshine in Kansas City, and we'll see you in a month. All right, guys. Bye. Take care.
Bye.